When the world is facing a global pandemic like Zika or other mosquito-borne diseases like dengue or chikungunya, it's important that governments are able to respond effectively and quickly. We have amazing new technologies and innovations at our fingertips that could allow us to respond better if only governments could quickly get at those good ideas and know how to implement them. Smarter crowdsourcing is simply the idea that we should apply curation, either automated curation using data science or manual curation using research that allows us to pinpoint and identify people with the right expertise to match that supply of know-how in order to solve problems more quickly.
It's bringing different people to the same table and having them talk to each other and bring new ideas, new perspectives to this problem.
Smarter crowdsourcing has the value of bringing in a variety of experts, not just on Zika, but on other issues, but that are experts on the topic that is the challenge, which could be, for example, behavior change.
We think that this problem needs to be addressed from very different perspectives. So we learn from the work that GovLab has already been doing, other experiences that they have had in bringing together a lot of people with governments to actually find implementable solutions. And we thought this was an experience worth trying. We were both thinking about how to solve a problem, and we found an ideal partnership.
What the process is about is very much soliciting practical, specific ideas and specific information about how to implement those ideas, what they will cost, how do I do them, how do I make them real. That's the thing that I think makes this a very important urban practice.
If you have the convening power and the proper networks, you can bring the people who are going to be valuable in thinking for solutions in a matter of a very short period of time.
Since smarter crowdsourcing is inspired by the principles of open government, which is transparency and collaboration, we're designed to be open by default. So what we're doing is publishing this information on our website, and other cities that are affected by the crisis, like Miami, can definitely access these reports and see what of the things that governments in Latin America found most interesting perhaps are also applicable to their reality, and they want to take a look at them to possibly try them out.
The big innovation here is a cultural one. It's working with government partners to develop a new culture, namely that of openness, the willingness to say, we don't know, we don't have all the answers, we don't have all the latest approaches that can help us to serve citizens well. And I think that experience of working with fabulous partners from government who have been humble, who have been ambitious in their desire to do things differently, who've been experimental, and who've been willing to be open in an online environment with strangers from around the world and to say, we don't have all the answers, please help us. I think that's the greatest innovation here.
And now Beth Simone Noveck, co-founder and director of the GovLab, here with Rudy Borman, the Undersecretary of Public Innovation and Open Government in Argentina's Ministry of Modernization.
Rudy, thank you very much.
Thank you.
Thank you for making this incredibly long trip. And thank you, above all, for the investment of time and effort on behalf of you and your team in the work that we've just seen presented, this project on smarter crowdsourcing for Zika. So we're going to spend a few minutes today, I hope, really talking both specifically about this project, but also generally about what it means to use new technology to help make government smarter. So to help cities, no matter how big or how small, bring not just citizens to the table, but in this case, the world's experts quickly to the table to help manage really hard problems. So Zika is, of course, a very useful test case for this effort, right? So you have a challenge here, which since 2015, right, if I have my numbers correct, you have 56 countries that are manifesting the pandemic. 47 of them are in Latin America. There's a lot we know about this disease, how it's transmitted by mosquitoes, how it's transmitted by sexual contact, how pregnant mothers can give it to their children and to their newborn babies. But there's a lot, there's a lot that we don't know, right? There's a lot of uncertainty in managing this. And there are huge uncertainties. And it's obviously not just Zika, which is the latest mosquito-borne virus, but also things like dengue and chikungunya. We have a dengue vaccine, but it's not very effective yet, and there's really no treatment and no medicines for this. So Zika is paradigmatic of a lot of challenges that cities face and that governments face. Today, you are the Undersecretary for Modernization of Argentina, a role that you've assumed now and on the basis of which very much your president has been elected, a modernization and innovation agenda, a role that you played also in the city of Buenos Aires as the director of the governance lab of Buenos Aires. So tell us just a little bit about the uncertainties and the challenges of managing something like Zika in your role.
Well, part of the problem when we began discussing the issue with the Ministry of Health, particularly, that was asking for some help and some advice in terms of how do we innovate in this in this problem, how do we attack it, and the Ministry of Health is a ministry that lacks a lot of tools, especially in terms of doing things fast, and especially when there is so much doubt, so much need in terms of getting new information, contacting with more people. So the problem, of course, was very important. In Argentina, we had a big outbreak of dengue at the beginning of this year, and this was a disease that was pretty much controlled because it was a disease that came from outside Argentina. So the cases grew up a lot, so that we had something that was supposed to be controlled, then grow up, then this new virus. So there was a lot of doubt about what was Zika really about. So when the idea of doing this project, of trying to organize most of the information and the experience that was being done by other countries, I mean, it was like a really interesting project, and we felt like for an innovation team, we were like the good partners for the Ministry of Health in helping them to accomplish the project. That it feels like a very simple project. I mean, at the end of the day, it's having these conversations, but it's also very, very complex. That's where we had to give some help to the Ministry of Health in taking the project ahead.
Before we talk more about what is innovative and different here, and as you said, in some ways it's very simple and yet so different to the way that we work, yeah. I think it would help us to understand how would such a challenge have been managed in the past? In other words, to understand why this is really different or in advance, I think it's important to understand what's come before. So in managing, whether it's a pandemic or some other sort of crisis, would you have previously worked with the Ministry of Health? How would such a challenge be managed? What's the typical way that you get expertise into government in Buenos Aires to manage such a problem?
Yeah, I mean, no. In the previous cases that we had, that were some dengue cases in which the Ministry of Health tried to attack it in a very classic way, and using the channels that already exist in terms of Ministry of Health and world organizations. And I think those channels already exist. The interesting part of this project is that brings to the table new ideas, new people, new technology in a very sophisticated way. And I think this is pretty much different than as it used to be. Because if you see the projects, if you see the amount of knowledge, the amount of ideas, the amount of information that was gathered in a few months, it's quite different than it used to be. So I think there is a huge opportunity there, also to scale the project.
Yeah, I mean, this idea was born of the experience that we've both had working in government and knowing what it's like to drink from a fire hose, to have too many things to do, not enough hours in a day. We worked on a previous version of this project with friends in Quito who were facing not the challenge of Zika, but in their case, the challenge of the imminent explosion of the Cotopaxi volcano. And in response to the question, are you talking to Iceland? Are you talking to the Philippines? Are you talking to other places with volcanoes? Are you talking to San Francisco, which deals all the time with managing crisis and anticipating a disaster? And the answer came back that so many of us are so familiar with, which is there's not enough hours in the day. We don't have time. And so you wait for the large, NGOs, and you wait for the large organizations. And I think we all felt that there was something that we could do differently here. We got a flavor of what that different thing is from the video, but I'm wondering if you could, from your perspective, and I'd be really interested as the person on the other side of the computer screen, and we have been seeing a lot of each other in the virtual world, so we're very happy to be together in the real world. There's one thing we can't do with this project is drink a beer together. But it has other advantages, and I'm wondering if you could just share with us from your perspective, what's going on when we see you through the screen, sitting with your team in Buenos Aires, what is this project about from a government perspective?
I think through the experience that we had with my team working in the city and trying to help, and our natural way of working was working with other ministries. We didn't have projects by our own. We always work with someone else. What we found here, it was the possibility to do something really fast. And as you just said, it's something that for the Ministry of Health, when we first presented the idea, they didn't have the time, they didn't understand the conference call. And I think that's where there is a huge opportunity for, call it I-teams, innovation teams, labs, or whatever you want to call it, to be a partner and help them out in terms of gathering information really fast. And if you think about it, and I have a lot of examples in the city, because in terms of technology of another kind of crisis, different crises like flooding, for example, or some other kind of problems, this model could be applied to different scenarios. And I think this is something that we are learning through the process. And what is really crazy also is like, it's the first time that something like this, which if you think about it, it's simple, but at the same time very sophisticated, has happened. A conference call when you bring 40 people, 46 people from different countries with different experience all together with all these ministries, with all these countries at the same time, documenting the whole project almost in real time in 3 languages. So it's simple, but it's not. So that's I think, in terms of learning the methodology and the power of having all this information compiled, information that can be also distributed to other health ministries. And I think that's something that we learn. And it's really fun when you sit down with the Ministry of Health and you are having this conversation. For the director of epidemics in Argentina, for him it was like a project that he didn't understood until we set him down, he saw the conversations, he saw there were other ministries from other countries. Again, simple but very sophisticated, but it's easy to learn and easy to replicate and easy to be applied to many other cases in which you need to bring ideas from outside government.
It's probably worth spending just a second to kind of explain. The movie did a little bit, but the mechanics may not be clear, and I'll just say ahead of time, we've left at the bookstore some binders with all the materials outlining, both in Spanish and English, how the project mechanics work, because I think, as you say, it is very, well, I wouldn't say it's easy. Thank you to the teams who've been working so hard on this project. It's not easy, they work hard at it, but let me explain just very briefly what happens. This is a project supported by the Inter-American Development Bank, which helped with the convening process of bringing 4 Latin American governments to the table as partners. So in addition to Argentina, we have Panama, we have the city of Rio de Janeiro, we have Colombia as partners on the project. And we started with the big problem of Zika and mosquito-borne diseases, and then we broke it down in consultation with global experts, in consultation with the ministries. We broke it down into 15 constituent problems. So you can't tackle Zika, it's too big, but you can think about what do we do about standing water and trash collection that leads to the accumulation of water where mosquitoes breed. You can think about how do we use predictive analytics as a new tool to track outbreaks and to surveil the disease. You can think about what is the right governance innovation structures to ensure that everybody has the right information. And you can, for example, as in the first conference, we focused on the topic of how can we do a better job of understanding what people do and don't know about a disease so we can develop more targeted and effective policies. So do people know that Zika is sexually transmitted? Do they know that they can get it from a mosquito bite? Do they understand what the transmission is between a newborn baby and the mother? And so getting at that, so we started by, I think importantly, defining the problem into more actionable, smaller chunks. And then we didn't simply crowdsource. We didn't simply say, hey, anyone out there who can help. It wasn't the same as an open innovation process. What we did was two things that I think are different. One is a curation process of bringing those global experts, so that last week we had the Deputy Minister of Health from Liberia on the line with someone from Facebook, with someone from a university in Panama, and somebody from a university in the United States, people who are technologists, people who are public health experts. In other words, a diversity of curated experts brought into conversation with one another to engage in what essentially then is an online conversation. So that part is pretty straightforward and simple, but I think what leads up to it is important, and importantly what follows it. And what follows it is then, after the ideas are generated in the dialogue, is then to turn the good ideas that come up, like, how can we do a better job of knowing what people know, right? So today, the way that's done in most places is to walk around with a clipboard or do random sample surveys. And so when you get Facebook on the line and Twitter on the line and professors who do network analysis and sentiment analysis, you begin to not only learn that we could use social media to better understand what segments of the population know, but in fact to get really practical advice about how to do that. And so that's the last step, which is to turn the good ideas into implementation memos, into actionable plans. So let me ask you then concretely, and it's unfair to ask you this because we're right in the middle of things, what have you gotten out of this so far? We've had some cool conversations. It sounds like there's a nascent collaboration that's really taking off, and I think that might be one of the most important learnings, is the collaboration between the Ministry of Health and the innovation team. What have you concretely gotten out of this? How will it change how Buenos Aires responds to and gets out ahead of mosquito-borne diseases?
I just wanted to add something else about your explanation. It's like building trust in the team from the Ministry of Health to bring them to the table and really respect their ideas, because part of the project was to let them organize what was the conversation going to be, and in terms of dissecting the problem in smaller problems. And I think this is important in terms of gaining trust from the ministry and say, okay, this is not someone that comes and tell me what are we going to talk about. I mean, we are really part of the conversation, and we really are adding a lot of value. And then what we found, and I think it's something that will only grow up in terms of how you can use new technologies and you can use data to address this kind of problems, is that probably a few years ago, projects like this one in which implementing something like digital listening was a little bit more far ahead, and now it's like it's really close. And it's exactly the kind of projects in which a ministry that it's really big, that it's really hard to move, will really need expertise and help to address such a sophisticated kind of tools in terms of bringing data to address this problem. But I think the learning curve that we had, that the Ministry of Health had with the whole project in only 2 months was really huge, was really relevant. And it can give us a lot of experience to address problems like this one, and problems that probably are going to be more complicated. Again, Zika shifted, and dengue shifted. We thought it was controlled, and then we saw this big outbreak in Argentina at the beginning of the year, and due to the experience that we had in the city of Buenos Aires, in which all the strategy was focused on water containment. You know that the problem is the bigger problem with Zika, dengue, and this kind of diseases are the mosquito. It's really easy for it to reproduce, even in a small amount of water, in a really small amount of water. So that problem is also connected with another problem that can be trash, for example. So if you have slums or poor neighborhoods in where you have a rain, and that rain combines with a specific temperature, and just a small amount of water stays in a bucket or something, you are creating more mosquitoes. So the problem begins to be much more complex. And I think that complexity can be addressed using data, using information, and that's where our ministry comes in terms of helping to attack the problem in a more creative way.
And I should say that I think one of the important other ingredients is that having the government partners at the table and in the room for the conversation means that the private sector actors on the other side, whether they're companies or whether they're academics or NGOs, realize that they're speaking to the people who are making the policy, who are delivering the services. And so we've had almost nobody, with the exception of people who are on a plane at the time when we're having a conference, nobody has said no to participating. Not only because they can do it in their pajamas, and it's no work or effort. They don't have to fly 8 hours as you did to be here, for which we're grateful. So it's easy to participate, but also now what we're seeing is everybody afterwards saying, how can I help? I'm ready to step up. And we're seeing that, for example, coming back to this digital listening topic, where the social media companies are stepping up, following up the conference and saying, we understand better what the problem is because we heard public officials in Buenos Aires tell us firsthand about the challenges they face with picking up the trash and the challenges that they face with removal of standing water, the challenges that they face in Rio with trying to survey the population using a clipboard. And people are stepping up to help, and I think that's what's also exciting, is that we're accelerating not only the generation of good ideas, but the acceleration of commitments. So let me ask you, you've been involved in, throughout your career, you've been one of the great leaders in open government and governance innovation. There's a lot of different models. The public lab model is one way of getting citizen expertise into government. You've done a lot of work around open data. We've seen work that we've done together around the use of expert networks to generate expertise from civil servants. Is it too soon, or can we say something about when is smarter crowdsourcing? When is this model the right model? What kinds of problems lend themselves well to this model of helping government get more expertise more quickly?
I think one of the, we discussed this with the team a lot, the good thing about this project, it has specific methodology, it has specific objectives, and I think this is exactly the kind of project that these new teams, you can call it whatever you want to call it, have to embrace. It's something that you can learn, it's something that you can replicate, it's something that you can spread widely, and again, it's based on experience, it's based on creating networks and knowledge, and I think that's where there's a phrase that we use a lot in the lab, that it's your capacity is your community. And this was a work of a community that works with health problems from different fields, and I think if labs, if I-teams work with projects like this, with very specific methodology, that's where you start moving from innovation as a very high-tech concept to something that is simple, doable, and can bring you a lot of results in a really small amount of time.
Rudi, thank you very much. If you want more information, check out zika.smartercrowdsourcing.org in the bookstore or online. Thank you very much.
Thank you, Beth.
Bye.